Welcome back to the Food Code. We are so excited. We've mentioned this interview a few times on other episodes, but we have Dr. Meg Mill with us today. She is a functional medicine practitioner, a doctor of pharmacy, and a mom of three, which I'm excited to learn a little bit more about how you manage it all, because she's also a bestselling author, podcast host, and speaker. And so in the functional medicine world, she does all of her coaching virtual, just as Becca and I do, that allows her to work with patients worldwide to help heal root cause issues and utilize advanced diagnostic testing as we do as well. So welcome, Meg. We are so excited to have you here and learn a little bit more about you and what you do.
Thank you so much for having me.
Of course. That is a lot, really underachieving here with all of these things. There's a lot going on. You do a lot. That's amazing. How old are your kids?
I have a 17, a 16, and a 13-year-old. So yeah,
Right.
They're busy moving, moving and grooving.
Absolutely. So awesome. We would love if you could introduce yourself. There's obviously we gave some information on you, but share a little bit about your journey. I feel like a lot of people get into, a certain passion for a reason, like what made you so passionate about what you do right now? I know that there's a little bit of a specialty with headaches, migraines, stuff like that. So can you share a little bit about your journey with this and how you kind of got into it?
Absolutely. So I graduated over 20 years ago with a PharmD, and then went on to do a residency in clinical pharmacy. And I was working as a clinical pharmacist in hospitals, in med management clinics, and I was seeing people really more, I would say, like surviving rather than thriving. I knew the protocols, I knew why they should be placed on all of the different medications, but they just weren't getting better. And I always really had this more, I really preventative care was more of my thing. I thought, there's so many things we can do in between where they are now and where, when they're started out. And so that was kind of one in my professional journey. But in the same time, I started having a lot of gut health issues, and I was going around to different gastroenterologists. And that was kind of even before celiac became like a wide known, thing. It was the sort of at the beginning of people being tested for celiac, and they were testing me for that. They were doing all this different, but I was getting no answers. So finally they just said, you have IBS, and sent me on my way. I was at Yale at the time. Like I lived in New Haven in Connecticut. So I was at Yale. So it was like a top medical facility. And then we moved and I went down to the Johns Hopkins medical facility. And then we moved to UPMC in Pittsburgh. It was all these different answers. And I just wasn't getting a solution. That got to the point where like I couldn't even eat anything because I just didn't know what was going to make me feel sick. And so I just was like living in this place where it's like, I'm told I'm fine, I'm in the picture of health, and I just didn't feel well with the medical knowledge and not getting the help. And I was actually with my cousin at one point at a family function, and she was telling me, well, I never really felt better in some of her issues until she found functional medicine. And at that point, I really didn't know what it was. I tried some holistic approaches of different things that really weren't helping either, but I was like, okay, well, what's functional medicine? And this was years ago, and I started looking into it, and I was like, oh, wow, this is intriguing. I have more of a natural interest in natural medicine. And so I started digging more into that. And then I started learning about it. And it was then I started to actually start to feel better. So I'm like, okay, this is working. And so I went and got the certifications in functional medicine and really finally felt better and found the root of my health issues and started, opening a practice then to share that with other people. And it's like you guys see, it's just really good to see that transformation in people's health where they feel so much better, and you don't think you're going to get there, or you're told that you can't and you just have to live this way or take medication. And we get to see it every day. So then I started to see a pattern when I opened my practice of people coming to me with headaches and migraines that were affecting their life on a regular basis, and it was making it hard to get through the day. Or the other thing would be coming to me with like gut health issues and other things from having to take long-term medication to treat the headaches and migraines. And I really saw this just being normalized. It was just this pattern of like, oh, people were just accepting, oh, I have to live like this. There's nothing I can do. I just have to take the medicine. There's no other options. Or I'm taking medicine and still getting breakthrough migraines. And I just became passionate to open people's eyes that you don't have to. We'd start working together and they would say, my life's changed. I can't even believe this. I don't have headaches anymore. And once I saw that over and over, I thought I need to spread the word here that this doesn't have to happen.
Yeah. Awesome.
We can agree more. I mean, we see so many people coming to us, and we are very, very thankful for conventional medicine. Beck and I both have had different situations in our life that, it's been very helpful, but we've also walked our own journey to where we didn't get the help either. When I was diagnosed in 2014 with Hashimoto's, I was constantly tired. I was dealing with chronic constipation, and very similar to you, everything is fine. They couldn't really figure out what the root cause was. And at that time, leaky gut was just kind of starting to become a little bit of a buzzword, and then it wasn't until functional medicine that I was able to find the root of all of my symptoms, which was the gut. So I'm curious for you, can you share a little bit more about that? What you found on your journey? What was the underlying cause that was driving you to feel so poorly?
Yeah, so I think I just had a lot of dysbiosis going on. So I had a lot of overgrowth that no one would ever check, so they're telling you IBS, but really I'd say that's just like a label slapped on as I don't know, really, because it's like, okay, you've done the colonoscopies, you've done the endoscopies, they're not seeing anything that, and that's always a good thing to have. You want to rule out any major health issues, but after that, it's like, okay, what is it? Why are you having the stomach pain, the fact that you can't eat anything? And so for me, even, I actually, before even that, I tried the gluten-free, I tried the dairy-free, I tried to do it with, and that's why I tell people, like, you can try to do it with foods. I tried low FODMAP. Like, there was a lot of steps in this journey for me. And a lot of the foods are confusing. I know FODMAP is confusing for a lot of people, but when you're making these changes and you're still not seeing a difference, then I think that's when you need to look into a practitioner and really get that stool test or get something that's going to show, do you have an overgrowth? Do you, I had more just of an overgrowth. I didn't have like a parasite or H. pylori or anything that was found. Those are other things that can be causes. But once I really was able to heal that, I was able to heal the lining. I was able to get, do my food sensitivities, do all of that we call the 5 R's in functional medicine and kind of go through that, then I was actually able to feel better and then expand your diet. I mean, I think that's what people think, like, oh, you have to limit, but once you feel better, you actually can expand.
Mm-hmm. Yeah, absolutely. And I think, unfortunately, because I know a lot of people that go to, functional medicine, they want to do it naturally. Like, I want to resolve everything with just food. And it's like, unfortunately, sometimes the body just gets to a place where it can't heal itself. You have to have other support outside of that, like bacterial overgrowths. We see that all the time, wreaking havoc, or sometimes like way too low of bacteria. And then it opens it up for all of those things. So absolutely, it can wreak havoc. So I'd love to dive into a little bit of your specialty, and pick your brain for our listeners and, selfishly for us too, because I have interest in this. And because I think headaches and migraines, unfortunately, in like standard world, they're very kind of unknown still, like what drives them, what particularly causes them, the different types of headaches and stuff like that. So one thing that I think is really important and interesting is like nutrient deficiencies that can drive them. So can you go over maybe some of the top nutrient deficiencies you see associated with headaches or migraines, and maybe like what foods can help support?
Sure. So we look at different things when it comes to food. So we want to look at foods. It kind of is in two buckets. So we're going to look at foods that are triggers and foods that are deficiency. So I would say the most common, now I'm going to caveat this with, I do think everyone's unique. So it does take a little bit of digging into your own personal, what your triggers or what your deficiencies are. So it is hard to say the standard, but that it's across the bucket, because I think everybody's like, okay, well, this one bothers me, but this I'm okay. And we'll get into a little bit more detail on that. But I would say the number one most common nutrient deficiency is magnesium. So I think if you are someone who has, a common headache, migraine situation, it wouldn't hurt you to start magnesium. I like magnesium glycinate for headaches and migraines. That would be my choice. But depending on what else, like if you're constipated, maybe you do a citrate. I don't prefer oxide. That's what you find a lot of times over the counter. And like if you're going to walk into CVS or Walmart or somewhere like that, people pick that up. But if you can find like the glycinate form, that can be the best. And one of the highest foods in glycinate is actually pumpkin seed. So that's something even sprinkling on a salad or adding to a dish or something like that can be really helpful too. We also want to look at like riboflavin, so like things with vitamin B. And another thing is even fish oil, like salmon would be a good food to try because that also has the omegas. it gets even more complicated too with even choline, like eggs can be helpful because we need to actually process our estrogen too, because hormones play a role. So we need things that could so magnesium, B vitamins, cholines, those can all help you methylate your estrogen. So really getting your estrogen levels down. So it's like putting all these pieces in there to support different, wherever your almost like chink in the armor is, to support that for you, to really bring your body back into balance. So we also though want to look at food triggers and things like tyramines, salicylates, MSG, even caffeine, because caffeine can be used to treat headaches, but it can also cause rebound headaches. So some of those we know are common triggers. And so, but we want to look at really combinations and thresholds too. So I tell people a lot of time, what you can do is actually print out a blank calendar and then start to look at the days that you have your headaches and write down like what you ate that day and the day before. And so then you can start to see a pattern. So did you eat, it's really enlightening when people start to do this. One person I was working with saw olives and she's like, I would have never thought if I ate an olive, I just never put it together. I've had headaches my whole life. And so these like little things start to come out when you start to look at the patterns, and you can kind of start to identify your particular triggers, which can be really helpful.
Yeah. I was going to even say that I know you mentioned magnesium first, and magnesium is also something that often gets depleted with like parasites, pathogens, stuff like that. They kind of basically take all of it, or our body overuses it to try and help manage that. And so again, like everyone is so individual, because you could basically just be supplementing with something that if we're not addressing other pieces, it becomes, and this is why I think so many people try and supplement. We actually just did another podcast earlier that we recorded on like, you can't supplement your symptoms. You got to figure out like,
what they are. And
what's different,
Exactly. And that's what I say to people when we're working together for this particular, for headache, for everything. But we become like your detectives. We're your health detectives, that what we're trying to do is put all of it's flipping it upside down. So in conventional medicine, we're treating the symptom. You have the headache, they have I'm going to use just headache. We would put migraine in there, too, but you're just covering up the pain. You're trying to treat that. And we want to flip that upside down. And we actually want to say like, okay, that's your symptom. What are all the connections in your body that are like telling each other all these signs? And like you're saying, it could be something as underlying, like an underlying gut infection can be why you're having your headaches. A parasite can be why you're having your headaches that you're not ever even looking to or even thinking to associate.
Yeah. And I love that you brought the awareness up too. I mean, I know there's a lot of food sensitivity testing and things that you can do out there. We use some in our practice. I know that you use some in yours as well. And that's a different topic for a different day. I think that it can be helpful, but I always tell our clients, you know your body better than any test out there. And so I think it's really important to bring that awareness and start to make, correlations yourself, because even when you're working with a practitioner or, a doctor, a functional medicine doctor, they're not going to be with you 24/7 or for years and years on end. We want to teach you how to be, a bit of a detective yourself. So I love that correlation that you brought up, because yes, who would have thought olives, which are delicious, by the way, could be triggers, but everyone is different. You also mentioned something that I would love to kind of shift into and talk a little bit about hormones and estrogen, because we know that this is very dynamic. And again, estrogen, when she is getting out of hand, we always refer to her and progesterone as twin sisters, right? But when estrogen's getting out of hand, the party kind of is over for a lot of people. So can you talk a little bit more about estrogen and the role that plays with headaches and migraines?
Absolutely. So estrogen dominance and a rapid change in estrogen are the two most common hormonal causes for migraines. Now, what we have to do is we have to look at why, so we want to just not say like, okay, you have headaches, so you have estrogen dominance. We want to look at, okay, what's going on? Like you're saying, do you have low progesterone? Are you not metabolizing estrogen in the way you need to? Because I see often when we have this dynamic, if you're going to go to your doctor and you're going to get a blood level of estrogen, you're going to get an estradiol. And so that changes every day of the, it's fluid. It's going to change every day of the month, depending on when your cycle is. So you have to really get it at the right time. But the other thing is you're not always seeing the metabolites. And so I can often see with people, not only if they have high levels of like an estradiol estradiol, but then we want to look at how they're metabolizing their estrogen, because sometimes they could actually even have a lower level of estradiol, but they're metabolizing it into stronger levels and stronger metabolites that aren't clearing. So we want to make sure that, I always say use it or lose it. Use it, then lose it when it comes to estrogen, because we want to make sure that you're really getting that estrogen to metabolize through your body through all the steps. And so we work on creating that balance and making sure that your estrogen's balanced with the twin sisters are in balance and happy with each other, and really start, and things they can do today. You talk about this like a lot, but like, really just cutting down on xenoestrogens in your environment, really looking at your face products, looking at the foods you eat. Are you eating grass-fed, beef? Are you eating dairy that's not does not have hormones in it? So we want to just take a look at all of those extra estrogens that are coming into our body, if just as a very first step of really creating that balance.
Yeah. I love this. Can we take it a step further? And I want to just ask, because I actually was just speaking with somebody this week who had a Dutch test done, and saw that she was very high in estrogen, wasn't metabolizing properly, and also had some gut things going on. And so I was kind of asking her, what did you do diet wise along with all of this stuff? And there wasn't really any clear recommendation for her on how her diet should change. And so I had to go down and kind of explain, whether it's gut or hormones or whatnot, we're always pairing these supplemental protocols with dietary changes and lifestyle changes, as you mentioned, right, for xenoestrogens and whatnot. So talk a little bit about, maybe some foods that you commonly recommend for women who are estrogen dominant or struggling with these things, maybe that can help them, detox estrogen a bit better.
Yeah, so I really, cruciferous vegetables are a really good one. So we know that the cruciferous vegetables will help shift your estrogen to the CYP1A1 pathway, which we want it to do. And the Dutch test shows that in order to metabolize the estrogen. So we really want to, and really focusing, I always tell people, try to focus your carbohydrates as vegetables, non-starchy vegetables. So if you can really change your perspective on what a carbohydrate is in some ways. I mean, I think when we think of carbs, we think of breads and pastas and things like that. But then our vegetables and our fruits and things that are nutrient packed are also carbohydrates. So we work sometimes on shifting really to trying to get your carbohydrates through vegetables and fruits, and really get rid of those processed carbs, and then work also on pairing those with a fat and a protein in order to really balance blood sugar. Because it's like we get a whole nother topic about blood sugar too, but blood sugar plays a role. We have, and really, and then we can get into adrenals, and they're all talking to each other. So all of these hormones are talking to each other. So really getting to a place, that's a place where you can start, is really looking at things that are going to help balance that blood sugar.
Yeah. We talk a lot about blood sugar with our clients. So, and obviously blood sugar high and low can drive the headaches too. So when someone comes to you, like within your practice and within, working with clients, where do you start? Obviously, again, like we've talked about, it's all kind of individual, but are there particular places that you typically start, every client with, essentially?
Yeah, so we start with, I have a method called my E.A.T method. So it's enlighten, align, and thrive. So we work on first starting with enlightening. So we really work on discovering your triggers. So putting those connections together, really looking at your food. Food's a really good place to start, actually, because like I said, you can just start there. Actually, the very first basic steps you can do, everybody can do this right now, is try to increase your hydration and stay and sleep, because they're actually independent risk factors for headaches that no one is like really thinking about, that those are two easy free things that you can do right now to get that to change. So if you can just try to sip your water throughout the day so that you stay hydrated at a cellular level, and not chug it all at once, because sometimes we excrete the water when we're doing that. So if you have that glass of water by your desk and start with hydration, and then just looking at how you sleep, like what are you prioritizing your sleep? Are you getting good quality sleep? So we can start there, and then kind of move into maybe printing out that calendar, looking at your foods.
Yeah. I love that. I love that little acronym. Mm-hmm. That's very catchy. So something that one of our clients actually wanted to know around headaches is, can they be genetic? So like, they were trying to evaluate and digging into their headaches and their migraines, and are, running some protocols for themselves. But do you see that as a possibility with people? Like, is that I know, like for example, type 2 diabetes. A lot of people think it's genetic, and technically like you could have genetic predisposition per se. But can migraines and headaches be that way?
And I think that's a great question, because I hear it all the time. Oh, I have the migraine, like migraines run in my family, or I have a migraine gene. And I don't know of any migraine gene. So I would say no there, but yes and no. So it's exactly the same thing that you're saying. So there isn't a migraine gene or a headache gene. However, we can have genetic variants that set us up as more likely to get headaches. So we could have a genetic variant that makes us not have a DAO enzyme deficiency. So we don't process histamine as well. And histamine overload can be one of the things that triggers headaches. Or we can have the MTHFR gene that makes us not methylate as well. So like then we go back to the estrogen, and we need to be able to methylate it. So it's more of different things that happen together in combination that create this dynamic. But the great news is that we can overcome them, because it's not like, oh, you have this genetic problem. They're just things that, okay, well, you have this, so we need to make adjustments to what you're doing in your life in order to overcome some of those steps. So it's all something that can actually be overcome, and we can work through.
Yeah. Just like type 2, right? It
Yeah.
can be prevented.
Exactly. Yes.
I want to follow up to this, because this was another question that she had, and we kind of just made this connection today. So it's one of my clients. Actually, she went off of her antidepressant a month ago, and this was her decision, her doing, and she's been feeling really good. She said, this is the first month of my life I have not had to use my prescription migraine medication. So I also have have her on an anti-inflammatory protocol as well. And we're in a reintroduction phase. So the question was, is there a correlation? Do you see this often sometimes, that headaches get better when somebody comes off of a prescription, let's just say any prescription, maybe that's depleting us from certain nutrients?
Absolutely. So, there's always a side effect. I think we blow it off, and we laugh at the commercials. It's like, this is the best drug ever, but it can do this and this and this and this. And like, basically it's, all these things that you're like, okay, that's terrible. But they really do have side effects, and everyone responds different, and you can always be the 1%. And serotonin, there is a dynamic when it comes to like vasodilation and migraines with serotonin in particular. So depending on, what was going on with all of her serotonin levels and everything, that can also play a role. But we see drugs have, like birth control is another good one, because birth control can deplete. You're actually just suppressing some of these hormones. You're not really getting to the underlying root of your hormonal imbalance. And then it can also deplete nutrients. So sometimes like the SSRIs or the birth control are things that are used, but they're, again, not really solving it. It's just saying like, okay, you're having this symptom. Let's work on the symptom and not solve it. And then we can get some underlying issues going on.
Yeah, absolutely. So when people have migraines or headaches, or that's something that they maybe chronically deal with, are there any tips? Everyone loves tips. To an extent, I kind of hate tips, because it's like, it's a much bigger picture than that, but like reducing severity of them, and starting to work on hopefully eradicating them. But like, if they're having them, if they know one's coming on, stuff like that, are there any things that you recommend to clients to help reduce the severity of them?
Yeah, so I would say right away. So don't wait, first of all. Don't just think like, okay, I'm going to get through this. Right away, drink a full glass of water. So you want to try to increase your hydration and see if that can start. Then also keeping like a lot of people have success if you're trying to look for an alternative to the medication. A lot of people have success with essential oils. So actually, putting like a peppermint or a lavender oil. I know some of the different companies, like I know doTERRA has like a past tense blend. I think Young Living has a blend, and just kind of putting those on your temples can also be something that is helpful to catch it right away. Or even like taking an anti-inflammatory, like a curcumin, or something that's actually anti-inflammatory right away can also help, so that you're not in that place where you're pain. And I get it. When you're in extreme pain, you are going to that, you're looking for the medication, because at that point you are in pain. You need something to really help you get through it. But we want to try to do those things and make the connections before, so we're not getting them.
Yeah, absolutely. Like, this is just a in my mind it makes sense, but maybe it doesn't make sense in reality. Would like any way of getting improvement in vacillation work to like open blood vessels a little bit more so that there's not, I'm imagining that like the constriction of blood vessels probably drives some of the pain. So
Yes.
like a sauna or a warm bath or, anything like that.
Yes, absolutely. And some people actually either warm or cool cloths on your head too.
Yep.
So your constriction too. So that's also another thing that helps. And just going in a dark room with a cloth on your, putting a cloth on your forehead can be a big help at that time.
Yeah. Really funny story is I actually, when I was in college, used to like think that people that had migraines were just like big babies and they were just headaches that they couldn't tolerate. And then I got a migraine once in college and it was one of the worst experiences of my life. Like I was like, I had to pull over and vomit on the side of the road. Like I had to like get in a dark room. I was like, okay, these are real. This is a real thing. I used to think that they like, I was in college. I didn't know any better. But yeah, they are, people that deal with them chronically, I could imagine how crippling it could be. And wanting, a quick solution and something that's like, can I just find something that helps with this right away? But again, as we always talk about, getting to the root cause of things.
And if you take that time up front and you're doing, you're taking these steps, then you're not getting, I do see a dramatic, you can't say you'll never have a headache again because that, our bodies are dynamic and something can trigger you. But what I see is a significant decrease in both the incidence and severity. So you're not at the place that you are, you're not having to take the regular medication. It's not, the best quote I heard was one of the people I work with said, I just don't wake up anymore and like a fear it will be a headache day. Like you can live without that. Like, oh my gosh, is that going to be today? Like, or am I going to plan something and have to miss it? Like, because I'm having this severe migraine, which is life-changing, really.
Yeah. I mean, I was not treating my body great in college. Let's be honest. I understand why I probably got a migraine.
Yeah.
I have one other question, and then I know Liz has some questions as well. I have some clients that, they talk about how their migraines have been there since children. Like since they were a child, essentially. And I feel so bad. I can't imagine a child like a 6, 7, 8-year-old having a migraine. But is there something that you find drives it more for children, before maybe obviously like hormones become a thing for them and, hormone fluctuations? Like, is it more, do you see maybe gut, histamine, food allergy relation at that point? Or, I don't know if you obviously work mostly with adults. Like, do you know maybe anything around like why children get it at such a young age? And if that's a case, is someone that obviously it might be something they are more likely to struggle with throughout life?
Yeah, so a lot of people I work with have been getting them since they've been children. I have worked with a few children, and what we can do the same thing. See, like we were talking about, you have certain genetic propensities that are going to make you more likely to experience this potentially based on your genetics. So what we have to do is, again, kind of do the same process and look at what's triggering you, what, is there underlying things, depending on what age, they come, if there is a hormonal component yet, but there can be an overload of histamine. So even things like in your environment, we can go deeper too. We can look at mold, we can look at heavy metals, we can look at allergens. Even a thing that you could do is put a air filter in your bedroom just to really clean the air. That can be helpful for some people that are just getting that overload from allergens too. So it's really taking a look of everything going on in your life and then minimizing all of those triggers in order so that your body can calm down and not have the inflammation and not have the headache.
Makes a lot of sense.
It does.
I mean, I was telling Becca earlier, I was listening to a doctor yesterday morning that was talking about how, kids, when they are born, like they have leaky gut. It's our job as parents to raise them in a way that can really give them a great gut health situation or set them up for the best, health that we possibly can. And, I just think in this world, it's really hard to do that. You have 3 kids of your own. You understand that because you're best at home to manage things, but there's a lot going on out there. So I have 2 questions, and I apologize, these weren't on the outline, but what would you say to those who are struggling right now with headaches or migraines and they think it's just an isolated symptom? I don't know if you saw a recent video that we posted, but we're talking that we in our practice see a lot of clients coming in who, for example, constipation, but it's often very rare that it's just constipation, right? We dig deep, we find that there's actually several other symptoms that are also happening or things that are burdening the body. And so I can only imagine that likely if it's headaches and migraines that are chronic, there's other things going on. So what would you say to that person who doesn't know where to start, digging deeper, or, maybe give them a little advice on where they should go, AKA call you?
Yeah, well, that's what I was going to say. I think that the best thing to do is because there's so much information out there. You can Google, you can go on Instagram and see people posting, you can go on YouTube and watch videos, you can go anywhere and get information. The key is that you're getting bits and pieces of like, okay, this and that. And I see people get so overwhelmed, like, I don't even know what to do. I don't even know where to start because I hear this and I hear that and I'm trying to do this. And you may even think like estrogen dominance. Okay, I need to take DIM. Well, you might, like we said, not have high estrogen. Then I have people that have been coming to me like, well, I was taking that and it made me feel worse. Well, because that's not even your issue. So really finding someone that you trust and that can give you the clear roadmap. So I think that really what we can do as practitioners is say like, okay, we are going to help you. We'll be your guide. We'll connect the dots for you. So to make it like simple and easy in your life. And then you can just follow steps with the guidance and know exactly what to do. Because I think that can be overwhelming. It's like, okay, I know I have this. Okay, maybe it is connections, but what do I even connect?
Yeah. What would you say you often see kind of go hand in hand? Maybe it's more than one thing. Is it typically gut issues? Is it detoxification issues, hormonal imbalances, blood sugar dysregulation? What would you say are the top things that they're
I would say, for hormones for sure. So definitely hormonal imbalances can play a huge role. And then I would say gut, it depends on the person. I do see toxicity issues, detox issues, but I do see underlying gut infection. So it's really, I always say almost like peeling the onion back of how deep that we need to go. Like, can we go here or do we need to go to the next step? Not everybody needs to go the whole way down to all the steps. Some people just need, I had someone who came to me and we started I'll start certain supplements with people whenever they, come in the first time. And it was 3 weeks. And she was like, I've had a headache since I've been a child, like you're saying, since I've been a child, at least once a week my whole life. And I just immediately, as soon as I started these supplements, haven't had a headache since. So like some people can just be as simple as getting them right on the right nutrients. Others, it's like, okay, what's the next step? We got to find your triggers. Okay, what's the next step? We got to imbalance your hormones. We got to fix your gut. We got to, do you have mold? Do you even have Lyme disease? Like there can be like layer. So it's just how far you need to go.
Yeah. I think we get that so much with clients, and it's hard because, like how dysfunctional are you? Like how many systems are now involved because we've let this maybe go on for far too long. And that's the hardest part is people are like, well, I've been working on this for 1, 2, 3 months and like, I'm still having some symptoms or like, it's not totally better. And it's like, well, the body has a lot of systems that are at play here and we've cut back some of these layers, but there's so many more that we need to get to, obviously. Or, like you said, sometimes it can be, like, of course, those are the great testimonials. Like in 3 weeks, all of my symptoms are gone that I had for years, and we wish that could always be the case for people, but sometimes there's just so many layers of dysfunction. And it's, as a practitioner, it's always hard because you want the 3-week, relief and help all people in that way. But unfortunately, that's not always the case.
And I think if you stick, just like if you're listening, if you stick with it, don't give up. Don't say like, okay, I didn't get that result in the month or 2 months or whatever. I just was working with someone who had straight migraines for 5 years. And she regularly. And so we were getting better. And then probably 3 months in, she had a setback and we needed to get, go a level deeper. And now she's been migraine free for 6 weeks. She said it like truly changed her quality of life. Like she's like, I can't even tell you how much it's changed my quality of life. But there was a setback, once we were a few months into it. And if she would have given up at that time, she wouldn't have gotten to this place. So it's like, I know it was going to work, but you need to have the faith too.
Yeah. Well, and one thing that I always say is we have to also remember how many years are behind us of, I think about when I was diagnosed with Hashimoto's, I had 8 years of chronic constipation and I had 24 years of not a great diet and mold exposure and all kinds of other things. It's going to take longer than 2 weeks or 3 weeks or 2 months, or 6 months to heal the body. So my last question is, what is the biggest message that you would like to share or that you would scream from a mountaintop with our listeners?
Oh, I like that. Well, I just think I would like to just say, don't give up. There's hope. Like, I think a lot of people, when they get to functional medicine, like you're saying, have been dealing with things for a long time and maybe like just getting the same results. Like you're just not getting better. You've been there. I've been there. We've been in that pattern where it's like, I just don't feel well and I don't know that there's an answer. But, if you find someone you trust that can be a guide you see it every day. I see it every day. You can have these huge transformations where you can live your life with the energy you want. You can do, you're not exhausted anymore. You're not having the headaches. You're not having the gut issues or autoimmunity or anything. There is hope. So I think just don't give up.
I love that. Yep. There's a podcast that I listen to, and they always ask a question at the end of it that said, if you can have the entire world adopt one habit, what would it be? And I'm like, oh gosh, I don't know if I can pick just one, because I feel like, again, there's so much individuality with people, but yeah, maybe we should keep that as our new question for all of our interviewers. You were the first one.
Oh, wow.
We've implemented that question.
Yes.
Yeah.
Oh,
we also have a new setup here. So this will be one of our
Okay.
first interviews on YouTube, which is really cool because we had to get all the fancy equipment for it. So this was so fun. Thank you so much. We're really excited to share this with our listeners. And I know that you have a ton of content on your website. So I will be sure to link all of that out along with your Instagram, your Facebook, everything. Is there anything that you would like to just say as a final word before we wrap up?
Yeah, so I have a free guide at helpmyheadaches.com. So if you are someone with headaches and migraines, you can go download that guide, and it can give you, it's like 8 steps to get started right away. And I also have just recently started a podcast called A Little Bit Healthier. So I just show little health tips on there. That's if you're obviously a podcast listener, so that's just another place to find me. So yeah, thank you so much. I really appreciate it. Have a great day. Thank you.